WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
The patient is our focus. Our passion for helping others is our drive. Knowledge is our greatest strength. This is the time for pharmacists. Pharmacists around the world are saving billions of lives. Take a picture with the letter P to show that you're on the coronavirus front line.
Hello, everybody. Good evening. I would like to welcome all of you. It's 42 times already that we met on our webinars. It's from the beginning of the COVID-19 pandemic. I would like to just remind you that we are on the free channels on the YouTube, on the Pharmacy College website, and on the Facebook, where you can join us. Yeah. Today we have wonderful guests with us. So the first one is Katrina Fehi-Sola. She's CEO, the president of Employed Pharmacists Europe, the largest European trade unions. And our second guest is Mark Kozio. He's a hero, an icon of the pharmacy in England, and also a founder of the largest and most effective trade unions, I think, in the history of the planet. So I welcome you. Thank you very much for accepting the invitation for this evening. We are going to talk today about the role of pharmacists in pandemic. We get some nice presentation from Katrina. Also, we hear what our friends in England are doing. And I'm hoping that you have a wonderful time with us today. So let's start with Katrina. Please tell us what's the time of COVID-19 for pharmacists in your country?
First of all, thank you for inviting me to be with you today, and thank you for topic because it's very important. I think, like we heard in the video, that we are very important because we have a great knowledge and we are last in the contact with our patients. So I think pharmacist is always on the first line and always with the patient. So it's very important topic today. And of course, we will talk about a campaign you made, Pharmacy Heroes. It's a very good campaign, and we in Croatia joined. And our organization, European Community Pharmacists, are joined. So it was very, how I say, timing, good timing for that, because we are all lost in the pandemic. It's the first time we met something like that. So that's a group of pharmacy heroes, and this campaign was very supportive and very, very important for us, because in this group we can exchange our experience, how to say, what to do, and etc. So today it's very very good to point what is the real role of the pharmacist in pandemic.
On the top of what you just said, I add a few things, because what was motivating us in this campaign is that all the stakeholders forgot about pharmacists. They were saying thank you to nurses, thank you to doctors, but it's like all the traffic of the patients were taken over by pharmacists, and I haven't heard any kind of thanks from the government. That was absolutely disappointing for me, and hence was the idea to introduce such a project, and we are happy that so many countries actually took part, and thank you very much, obviously, for the support of my friends from abroad. That was actually very, very, very cool what you've done, and we really achieved a great response rate from this project. So thank you very much.
The whole world was in this group, so it's very interesting to be part of this. So great.
It was spontaneous what we've done about this project, and we didn't expect such a good response, basically. So it was unbelievable. Mark, and what about you? How's England performing at the moment? And you always have so many things to say, interesting for us. We're always far behind, so please tell us an update.
So the update was the whole nation was taken by surprise, just like was Poland and Croatia and all the other countries when COVID first started. But it went into lockdown about 3 weeks too late, which is one of the reasons why we have one of the highest death rates in the whole of the world per head of population. But when the lockdown did happen, it was quite a disciplined lockdown. The streets were empty, no cars were driving anywhere. And if you were out on the streets, you were being asked by the police, where are you going? You're supposed to be at home. So we were quite lucky as pharmacists because we were given a pass to be able to travel, because as important key employees, we were able to go to work. What was very, very interesting, and I think this is probably one of the most important developments that we didn't expect, is that the doctors all went home, they closed their practices, and they saw patients like this on the screen. And patients had to see them in virtual appointments. Now, the result of that was that community pharmacy remained open, and 30% more people came to the community pharmacy during the lockdown than when previously went to the pharmacy. So the public noticed that pharmacists stayed where they were. They didn't go away. They didn't see patients virtually on a screen. And unlike in Poland, as you've described, where people forgot about pharmacists, pretty much from the start, pharmacists were being called heroes, even by the government, because it was the only healthcare centre that was accessible for people to walk in without an appointment. They could no longer go to GP surgeries because they were all closed. So they were all coming to pharmacies. So that was a very powerful thing that nobody expected was going to happen. And it really has enormously improved the reputation of community pharmacy in the UK. I'm going to meetings all of the time with people in government, and all of them are saying, we remembered what pharmacy did. We remembered where pharmacy was when this all started. And it's our job as a trade union to make sure that they don't forget what it was that pharmacy did. Because even though 30% more people were coming into the pharmacy, there wasn't enough PPE for pharmacists. So the government was telling our members that they should work without PPE. So we were having to shout at the government and force them to make personal protection equipment available for pharmacists. At least 4 of our members died during the pandemic because they caught the COVID and became very ill and unfortunately died in the end. But nevertheless, pharmacy remained open, it stayed open. And another very, very good thing happened. Pharmacists decided to make some really, really interesting professional decisions. And they were doing this because you couldn't phone the doctor, you couldn't get the prescription, you couldn't do the normal things that the rules and regulations normally told you that you had to do. Now, we had a meeting with our pharmacy regulator, and we said to them, we want you to write a national letter to all pharmacists to say that during this pandemic, if you're making professional decisions that go outside the normal rules and regulations, the regulator will not take action against you as long as you've done this in the interests of the patient. And I can tell you, surveys have been done of the public, and they really, really value the flexibility that community pharmacists were able to give them, because let's face it, they didn't have prescriptions. You couldn't speak to the doctor, and pharmacists were making those decisions on the spot. And often they were doing things that they would not normally do in peacetime, in COVID-free time. So I'm very, very proud of the way the profession responded in that regard. And then the autumn came along. We got out of the first lockdown, as probably Poland and Croatia did. And the government plan was that we had to have the largest flu vaccination programme ever in the history of the UK, because they knew that another wave of COVID was coming in the winter, and they did not want the hospitals to be filled with patients suffering from flu. So community pharmacy did millions and millions of flu vaccinations, and we were very, very busy all the way through the autumn. And that was another really big success story for pharmacy, that it was able to do such a very, very large number of flu vaccinations. And the interesting thing is, and perhaps the same is in Poland or Croatia, I don't know, but very, very few people are ill with flu now. Now, I'm not necessarily saying it's because we succeeded with the vaccination program, because there is a very large body of scientific evidence that says there's no flu because nobody's coughing on anybody, everybody's 2 meters apart, and we're all washing our hands. But nevertheless, we haven't been inundated with flu, thank heavens, because all of the hospitals are now filled, absolutely filled with COVID patients, because we're now in the third wave, and sometimes nearly 2,000 people a day are dying of COVID in the hospitals. So the community pharmacies are very, very busy again. And the question that now is, the program that we're now all interested in is the big vaccination program. As many of you will know, more than 10 million people have now been vaccinated in the UK with the first vaccination. But this has all been done in very large centres like hospitals. 200 community pharmacies have set up big tents in fields, or they've rented out church halls or scout halls so that they can get 500 people or 600 people a day vaccinated. And we launched a campaign this week to say to the government, let the little small community pharmacies give people the second dose of the vaccination, because that second dose of the vaccination is due, because we're using AstraZeneca here in this country, is due in about 7 or 8 weeks. Now, at that point, the hospitals will no longer be able to offer the first vaccinations only, because somebody will have to give the second vaccination. So we have a choice. We either slow down the national vaccination program, or we say, give community pharmacy the job of the second vaccination, because the large centres can carry on the first vaccinations at top speed. But our condition is we want a second pharmacist to be available in the pharmacy to give those COVID vaccinations, because it will be impossible to keep the existing pharmacy service operating if the pharmacist is spending all of their time vaccinating patients. It will be dangerous for the patients. It will not be good for pharmacy at all. So we are saying, give us the second vaccination, but allow us to have a second pharmacist to deliver these vaccination clinics.
By the way, have you gained any kind of privileges during the pandemic? Have the government given you any kind of extra privileges? Like, for instance, in Poland, we got like a license to prescribe medicines to all our families up to third generation back, as well as except the controlled drugs. We could just produce sanitizers and antiseptic gels as well. And in general, also the regulator was not so firm on basically the inspection was not so firm on basically demanding certain rules or laws basically when it's about patient health basically. So how about
well, in the UK, the privileges, but we had to argue for these privileges. They weren't just available, we had to argue for them, and the number of them eventually came our way. So when pharmacists started to die from COVID, the government eventually gave us what's called a death in service benefit. So we were able to, as pharmacists, go onto the government's national scheme that if you've died in the service of healthcare, they will pay for your family to have some money to help look after the people that you've left behind. Pharmacists weren't in that program in January, but by the time we got to April, we were in that program. So that was the first benefit you could argue that we got. The next benefit was the government, not in all of the UK countries, but in some of them, have given pharmacists a £500 thank you for being on the front line. But it wasn't just to pharmacists, it was to nurses, it was to other healthcare professionals. As a union, because we are a trade union, we've managed to negotiate with some employers, and some of the employers, we've managed to negotiate £500 additional bonus to pharmacists, because they have been on the front line, they have been working long hours, they have been working in different conditions, and often without PPE. So these were some of the benefits that we've had. In the UK, pharmacists have been able to write prescriptions already for several years now. So that was a privilege that we already earned before. And lots of pharmacists have been prescribing during the pandemic. But a lot of pharmacists are now, and here's a very interesting role that we didn't think was going to come our way. I know that some of you already had the Pfizer vaccination, and some of you will be very familiar with how you prepare the vials. You add the diluent, you stir it very slowly. None of this is a rocket science job, but guess what's happened? Pharmacists have taken that role because everybody said, oh, there's a pharmacist, let's give that job to the pharmacist. So the nurses are turning to pharmacists, the doctors are turning to pharmacists, the technicians are turning to pharmacists as experts in the handling of the vaccination. And let's face it, these vaccinations are probably the most valuable substance on earth at the moment. So that was a role we weren't expecting. And a lot of people see pharmacy as an authority now in the whole management of the vaccination program. So there are some of the benefits that we've had as pharmacists in the UK.
Wow, that sounds really cool. I like it.
We don't have benefits, so I'm glad to hear what Mark said, but in Croatia it's not like that. Pharmacists are not included in vaccination for flu or COVID, of course, and not included to prepare Pfizer vaccination. So we need to do a lot of job for position of pharmacist.
Katrina, I think we will just listen to your presentation now, and then just make a short summary for us.
Okay. Tell me, is everything okay?
Absolutely, we'll tell you in a second.
Do you see presentation?
Yeah, perfect.
Do you see it? Yes. Yeah. Okay. I will talk about the impact of COVID-19 of community pharmacists in Croatia. And like I said in the introduction, I was very happy to participate in this campaign. It was very, very helpful for us. From the beginning, in the first wave, during the outbreak, community pharmacists see patients face to face. And we are always open, like Mark said. We always be there and open for our patients. GP, no. There was no change in healthcare provision of role of community pharmacists as a result of COVID-19. And we have a lot of concern regarding the approach because we have a lack of protective equipment in the beginning of the epidemic. We face shortages of equipment, shortages of alcohol and disinfection, and of course, all of that we doubled increase of patient coming to the pharmacy. It was very hard time for us in the first wave when the pandemic started in Croatia. After that, some of our organization, Croatian Chamber of Pharmacists and National Health Institution, prepared some guidelines and standards for us. It was very good because every week we have new standards and new guidelines, and we all work in the same way in Croatia. Most important thing that Croatian Health Insurance Fund changed the guideline regarding the allowed switch between generic or original drug, because we in Croatia can't switch it. But during the pandemic, pharmacies that have specific drug, it was allowed to switch to a generic drug that was available in the moment in the pharmacy. It was on the first wave. Now in the second wave, we have the same situation, but they don't approve us to change. So we finish with that guidelines and standards. Of course, the main goal was to avoid patient coming to the pharmacy more than once. And in the case of shortages, to make the process easier for patient and avoiding the contact with GP. Like Mark said, in the first wave, lots of GPs were closed. So we are only health professional where a patient can come for medicine and ask for medicine. In the first wave, Croatian Health Insurance Fund has allowed to home delivery of orthopedic and medical device, what are distributed via pharmacists. Now we have problem because orthopedic house and medical house still delivers medical and orthopedic devices to home of patient without a pharmacist. After that, Croatian Chamber and the Croatian Ministry of Health in the first month of COVID-19 pandemic has agreed, and they making a new working hour for community pharmacists, and all pharmacy in Croatia work from 8 a.m. to 5 p.m. And of course, we faced shortages of medicine and masks and disinfectant and alcohol. And to ensure to supply all of that, you can buy only 2 boxes or 2 pieces per person. So if you want to buy paracetamol or ibuprofen, you can buy only 2 boxes. You can buy only 2 boxes of alcohol or 2 disinfectant. So that way we try to get to all patients to get some of drugs and medical products. One thing it's very good, was very good in cooperation with the Croatian Health Insurance Fund. We implemented the National Health Database. That was information about people who get self-isolation measurements. The procedure, it was the pharmacy need to check the status for every patient who wants to enter the community pharmacy. So when patient come, they give us a card. We check is everything okay with him, is on epidemiological status is okay or not. And when we see the patient has no restrictions, he can come inside of the pharmacy. But problem was when the pharmacy noticed that patient is not following the restrictions, then we need to tell him to go home and be obey to isolation measurements. That was sometimes problem because patients, of course, are angry and they need the prescription, and sometimes we need to call the police to take this situation. It was not good. Like I said, we faced the shortages of alcohol, and in Croatia, the amount of ethyl alcohol which a pharmacy can order is under the law and is restricted. And during the pandemic, the restrictions are suspended, and that was good because we can make preparations, disinfections, and everything else for our patient. And problem again, when we, during the pandemic, the prices of protective equipment, alcohol, tremendously risen. So we get state inspections start to conduct inspections regarding the prices in all pharmacies. So we faced the double patient in the pharmacy, we faced epidemic, we faced the lots of people in front of doors, and of course inspections. We have recommendations for organize the workflow in 2 or more teams, depending on number of the team. Example, in my pharmacy, we work in 2 teams, and most important thing is that we didn't meet in the pharmacy. We take a half an hour break where we make disinfection and switch our teams. So we work like that 1 week, 2 weeks, or switch teams every other day, depends what manager in pharmacy decide. It was very hard because you work 9 hours or 10 hours, 2 weeks in the row, and it's very hard for pharmacy. This is a picture in one little pharmacy in Croatia. Recommendations we need to follow, and they are very strict. hygienic measures, social distancing, using protective equipment, plexiglass barriers, and the patient could enter, like I said, after the when we check the epidemiology status. And many pharmacies worked only on the front door, not allow anybody to enter inside the pharmacy, like you see on the picture. So you basically work on the door. It's not a really nice place to work. Or this picture in the one big pharmacy in my city, when we work at the door, but you have small window and patient are in front of window, and it's like a very unusual situation and very hard to work like this in this ambient. A little bit training during the pandemic. We have trained and it was very good organized, just online. And some of the medical organization or society have created a web page where health professionals could find information regarding COVID-19 virus. And this was very good and very quality information we have. Croatian Chamber of Pharmacy was responsible to providing information regarding pharmacists and topic covering pharmacology, etc. So we provide training all time during the pandemic. This is a picture from different pharmacy in Croatia. This was picture in one newspaper. Then we want to show our patient how we work and share some messages like stay at home and stay safe. And we come to the second wave of epidemic. On this slide, you will see that Croatia was not really good in the second wave because we have lots of infected cases, and there was really panic in Croatia, and government, like in other European countries, locked down Croatia for second time. What we're facing now, we're facing moral injury. We need to balance on physical and mental health care. We have lots of problem with that and with patient and in the team of pharmacy. And of course, depression or post-traumatic stress disorder, because our patients are really stressful and we need to manage it. So we need lots of education in that field. We need to create a culture to safely discuss for emotional challenges of caring for patient and caring each other, learning from difficult experience, and of course we need to prepare for potential next crisis. Like Mark said, they have third wave. We don't in Croatia yet, but we need to prepare for that. And we, what is our role? It's very good to hear what is role in England and Poland. I think it's most important education ourselves and our patient, include pharmacy in vaccination and spending medicine, and ensure medicine for all our patients. This is a slide what I take from European Parliament. It's called Dealing with Burnout, 3 R's. And they show us to recognize and watch the warning signs for burnout, under the damage by managing stress and seeking support, and take care of your physical and emotional health. It's very important because we have a lot of pharmacists who are seeking support, and we need help each other. And the end, under this mask is always a smile, because pharmacists are always ready for their patients. That's all from from Croatia for now.
Mark, and before I just step to my presentation, I just would like you to tell us what were like the best you think things that happened about pharmacy in the UK, and the worst things that you dealt with as a trade union, because you've done lots of good job as well to support pharmacists during this time.
I think the best thing that's going to have a difference in the future is what I mentioned earlier, that we were open and everybody else was closed. It led to a situation where the only thing you hear about on the television, on the news channels, is the COVID crisis. Well, Donald Trump, but mainly the COVID crisis. And pharmacy found itself either on the television or the radio most evenings of the week, nationally. We have never, ever enjoyed such a massive national profile as we have enjoyed now. And we're just about to go into the next wave, because we are arguing that we want to take on the second vaccinations. So we've already been contacted by the BBC, by all of the TV channels, by the radio stations. That kind of publicity for our profession is a very, very positive thing, because we have a positive message to say. So that was the best thing that we saw. If I was to say what was the worst thing, and some of you might shake your heads because you might be employers, but we're a trade union, and our job is to look after the little guy. Our job is to look after the pharmacists that are working in somebody else's pharmacy. And some of the stories that we had to deal with, some of the issues where pharmacists were reporting to their employers that they've got COVID, and they were told it's only a cough, you can come back to work. And they said, but the staff have got COVID as well. They can all come back to work, just keep the shop open, no matter what you do. That was a low moment. Very few people, very few employers are behaving like that, but some employers are. The other thing that we saw, some employers selling paracetamol solution to mothers with babies for £25 a bottle because there was a national shortage. Now that got onto the television, and that did pharmacy a lot of damage. Fortunately, the owner in that particular case was seen as the bad guy, and it didn't reflect badly on the rest of the profession. But some of the worst moments, to be honest with you, were about people who were so focused on keeping those profits coming in that they really lost sight of the real crisis that humanity was facing and that pharmacists were right in the middle of. So there are some of the highs and some of the lows for you.
You know, so this just reminded me about this campaign that we tried to run, because I think lots of pharmacists actually, because when we perform also the research, like a survey about whether the pharmacists were working more or less, the survey showed that pharmacists actually were working extended hours. So that what happened, that 86% surgeries were not seeing patients. That was the result also from our survey. So I thought that actually it would be a great honor to prepare a campaign to support my colleagues and actually colleagues around the world, because this project was extremely successful. And to be perfectly honest, you know, we are from Poland. We are not basically the middle of the planet. And actually, we are really happy that this project was such a successful project that so many countries supported the whole concept. So we are really happy. And now I'll show you the presentation. I mean, the presentation is in Polish, but I will still talk in English. So just give me a moment. I'm just going to present it. It's always a problem to launch it. I don't know why, but it's just like that, unfortunately. So we prepared the presentation about this campaign to show our colleagues what we've done. Okay, give me a second. Now it's really evil machine. I just try to share the screen and it doesn't allow me. Okay, one more time. Got it. Okay. So I think now it's okay. Can you see my presentation? Can you see the presentation?
Yeah.
Okay. So basically, the Pharmacy Heroes campaign was, in my opinion, one of the largest campaigns, I think, in the history of pharmacy, because we tried to basically combine all the pharmacists around the world in this campaign. The main concept of the campaign was to form the letter P with hands, what means pharmacy, pharmacist. And we managed, obviously, to get support from many organizations like our trade unions, also local trade unions, and it was promoted by our friends all around the world. Also the friends from Belgium, Croatia, Austria, and others. So thank you very much for that. Many organizations basically joined us for this project, what was very pleased to see. the main motivation for me for this project was actually that nobody say thank you to us. And I think also at some point we started to talk to different influential, basically people from Instagram and from media who were making also the letter P and showing basically like thank you to pharmacists who are also on the front line, not only doctors and nurses, also pharmacists. In Poland, in the first 8 days of pandemic, we nearly seen 21 million of people. I just kind of remind you that we have 39 million of Polish citizens. So it was a massive, lots of people basically coming and visit pharmacists because they were worried that they'll be short of medicines. So actually, this was very, very interesting. And one of the good thoughts from the patients was like, we only have you. That was very nice sentence that was also said to us during this campaign, that only pharmacies were open and basically providing services. What also we were interested in our survey, which we performed, was to check how many doctors or nurses or general practices basically went on just sick leave. And there was only really minor percent of pharmacists who basically went on sick leave. So this was very good. We were all like basically motivated to provide patient support. And the most important thing, like to our pharmacists, we're asking them like about what kind of thank you patients were telling to them. And there was lots of very interesting sentences that they saved their life, and it was very good. I mean, many times I also hear myself very good like Thanksgiving, basically, you know, about that you helped me with the medicine, you provide me information. The main problem also was the education campaign, because at the beginning there was no materials, education materials, and as a trade union also in Poland, with the support of PGF, we were the first ones who provided this information tools for also patients, but also for pharmacists and pharmacists. So this was quite good. Also, the pandemic time was a very good time for us to do research, and we prepared a very nice presentation, which basically summarized all the additional services roles that were provided by pharmacists, also were extended by the stakeholders in all countries. So this is a very, very nice summary that we just prepared together with also Mark and Katrina. Pharmacy Heroes campaign, the main thing was to show the letter P, basically with the hands that pharmacists are on the coronavirus frontline, and we created a website where we basically included the pictures from our friends around the world. Some results that we are going to present you now from the campaign. Basically, there were 85 countries around the world that took part in the project. So this is the total of nearly 40% of countries and pharmacies from around the world. So this is very, very good, and I think this is a very good result as for the first time. We received a total of nearly 600 pictures, and nearly over 1,000 pharmacists, workers, employees basically got involved. It was not only about taking pictures. Some of friends were also sending us movies, providing motivation for other pharmacist friends from around the world. That was also very nice. We also were quite pleased that International Pharmacy Federation decided to take us under the patronage, which was very good, and we didn't expect it, so it was very good. And we say thank you to FIP, obviously. Also, children help us a lot, and the biggest radio stations and media were talking about our campaigns. This is very good. Also, the public TV. So it was amazing. Honestly, I never expect such a outcome of this campaign for everybody. Obviously, we always invite you to go to our website, Pharmacy Heroes, and just say that you like us. At the moment, there's over 6,000 people join us in the project. Which countries basically mainly participated in the project? So obviously this is Europe, Asia, Africa, North America, South Africa, Australia. So around like I told you before, 564 pictures were sent to us in the campaign. Mainly women, obviously, and the highest level of pictures sent was from Asia. So this is around 33% of all pictures that were sent from Asia. They were extremely motivated actually to join the campaign. It was interesting. Obviously, mainly pharmacists were providing us pictures, around 70%, but also pharmacy technicians and other healthcare professionals. Mainly the community pharmacy, a bit less the hospital pharmacists were only 34%. So that was the result of the campaign, and the total of people 1,000 over and 37. These are some pictures from the campaign from around the world. So you can see many motivated peoples, and honestly, campaign was unbelievable for me. I got absolutely touched as well. I mean, the way it was done, and I think the way it was just spread around the world, and everybody was trying to help. Also, many of my friends that I met during the FIP Congress and during the conferences, they helped me a lot and help us a lot to basically provide this information, positive motivational information around the world. So it's quite good. And honestly, we always invite people, our pharmacy friends, to share the comments through the website, also through the fan page. So if there's anybody who's happy to ask us anything about the campaign and join us for more, please do so. And some few Polish pictures of pharmacists from our Polish pharmacists. Here you can see also the president of the Polish Pharmacy Chamber that took part in the campaign. We also included some very important people like Dean of the Faculty of Medicine, that he's a doctor. So this was also a very nice sign of him to showing the support for colleagues. We are working on this integrated care models now, trying to make doctors and pharmacists working together. So I think it was a great guest from him to actually do that. And also some other famous people like Paweł Węgrzyn, who is a pharmacist but also a fashion designer, and many of different people who really supported the whole project. So obviously, I can ask you how many of you participated in the project. I'm wondering, and if yes, please visit our website and you can see more details about the project. So some important, interesting stories about from our friends from around the world. I think one of the most touchy ones was the one from North Macedonia, and basically. This is the only picture that they sent, and we also had a very nice picture from Egypt, and it was a couple of pharmacists working together, and this pictures was really going around the world after this campaign, and they were working through all the basically COVID-19 pandemic together. So I think it was also very motivating, and it showed basically the integrity of the profession around the world, that we stand by each other. Obviously, for me, the best part and the very touchy part was when actually children who were terminally ill because they were suffering from cancer, some of them, they were sending us nice pictures of supporting pharmacists during this time, and I think this was also done with our partner from Urtica. It's another wholesaler. And I think it was also very touchy, and it was just great that kids involved so deeply in the process of providing us with the pictures, motivating pharmacists, and I think it was great. So the whole campaign, the project in total was really impressive. And some few statistics from the platform. Basically, the total people who were users, unique users, was around 6,199. So this is very good, and basically people were around 2,000, over 2,000. They were just Polish visiting the website. So this is quite good and not bad at all. And basically, so now we just go to the discussion, and we just shortly summarize about all this project. First of all, I think all around the world, this pandemic showed the importance of pharmacists as healthcare providers. And this is one of the largest, basically, groups, medical professions around the world, which is playing the key role in the COVID-19 pandemic. And definitely we see from also our reviews that we've done, scientific reviews, that there were really lots of different kind of extension of the role of pharmacists during pandemic, and many governments decide to give lots of privileges And what happened also now in Poland, we are now expecting the pharmaceutical care pilot. So definitely I could say that this time shifted the profession towards, and we're a bit of in the backlog for around 30 years. And now I think it's just really moving forward really fast. And hopefully nothing will change and nothing will stop this process now. And also like the final one was the medicine provision. We are trying to basically always provide medicines for our patients no matter what. Also trying obviously the generic substitution, what was quite important also in the process. And we are hoping that basically now all these experiences that will manage to support us in providing new services, and obviously one of them is immunization and providing COVID-19 and also for vaccinations. And this is what's the plan for the next months. Last week, the government accepted that pharmacies are on the list of COVID-19 vaccination providers. Now we're just waiting for the last sort of summaries how to perform the training. But what is good so far that we're going to use mainly our experience from the previous workshops that we performed with Pharmacists Without Borders project from Canada, and also with support of our colleagues from UK, it's ACG Group, who was the first organization in the UK who were providing trainings for pharmacists in vaccination. So that's basically the full summary. So definitely, obviously, all the healthcare providers are important and they are heroes, definitely. But also pharmacists, who I think during this campaign were seen, classed, were seen and appreciated absolutely everywhere around the world. So the campaign was extremely successful, and as I said before, we did not consider that the campaign from such a small country will have such a great range around the world and global access, really. And we're really pleased that also organizations like FU and PDA just supported us, what was very, very good for us. Thank you so much for this, and thank you to everybody for basically supporting this project. So I'm just going to finish now the presentation, and oh, something happened, I think.
Where is Mark?
I don't know. I think he just disappeared. Okay. Anyway, Katrina. So, what do you think about this campaign in general? Do you think it was worth doing it?
Yes, I think that campaign must proceed and must support all the pharmacists, and maybe even more better now in second wave and maybe third wave. So I think we need together, involve together and exchange our experience and knowledge and everything, so we can be stronger then. It's very impressive in presentation. Really, congratulations.
I mean, we're hoping that obviously we'll not expect any more pandemic in the future in such a range.
I hope so. But Mark said they have third wave, so we must prepare.
Yeah. So, Mark, we're just talking about the campaign, that we are not hoping for another sort of a pandemic to come back. But I think the campaign was necessary. What do you think? It was worth doing it? What's your opinion? We should do more of this kind of campaigns?
Yeah, it's very important that we talk to people about what we do and who we are. But there is a phrase in England that says, if you want to be a duck, you've got to talk like a duck and walk like a duck. You can't just talk like a duck. And I thought your presentation was truly excellent. But there was one newspaper article that was embedded in one of your slides, and I wrote it down, and it's in Polish, so forgive me, but it said, teraz jesteśmy personelem medycznym, ale później będziemy znani znowu tylko jako sprzedawcami. And the key for pharmacy is to make sure that doesn't happen. We mustn't allow that to happen. And that's why all of the work that we do around the world around pharmaceutical care is such an important part of the future. If we want to continue to be known as pharmacy heroes, and we want to be relevant to the public, the success of what we do has got to be measured by more than just how quickly they can collect a prescription from the pharmacy. So that really is the underlying message that all the pharmacy leaders around the world and all of those who come to this meeting this evening have got to try and work out how we move to the new pharmaceutical care economy for pharmacy, because if we can succeed in that, alongside the public health role, we will continue to be pharmacy heroes and we will go from strength to strength in the future.
All we want to do is just that the government can hear us and use the resources, because I think everywhere around the world the healthcare systems are really collapsing, and any kind of pair of hands is great. Just if you have a chance, just use it. Anyway, it's most of the time it's unused resources. I don't know how many pharmacies there's in England, but in Poland we have around 28,000. So it's 28,000 hands basically to support the system. So obviously it will not make a day. It will not change the situation suddenly, but at least it's a zest of energy and workforces. So how would we summarize this meeting today? Shall we do more of this kind of campaigns, and obviously not about pandemic, but definitely promoting the profession, people mainly, because I think people should appreciate it. And people can make an influence on the stakeholders as well, on the government.
I think one of the things that you could do, Piotr, because you're very good at researching these things internationally, is to get the stories from pharmacists around the world next. So we build beyond pictures, and then you start to get pharmacists to explain what they did and how they helped patients and how they worked within the healthcare systems of their various countries. These will be very useful messages for all countries to learn from. So that'll be, I think, a very helpful extension of your project.
Yes,
Excellent.
I agree. We can ask Polish pharmacists how they're dealing with patients in epidemic and compare to other but just pharmacists who work with patients. So it's important to how difference are in different countries.
Absolutely, but I think the differences are not such a big ones anyway. It's just some cosmetics. I mean, some of the basically countries like UK.
But in some countries like England, you have many services. In Croatia, we don't have it. You fight for services, so that's a big difference. In Croatia, we don't vaccinate and we don't educate for it, and it's not in the future. I don't see it. Just for pharmaceutical student, pharmacy student in the faculty, they organize one exam for vaccination. So what about us, old pharmacists in pharmacy? So we need to do a lot of. It's different because medical pharmaceutical care, it's in England very spread in the pharmacy. In Croatia, try to implement in the pharmacy. So we have a difference.
But you must never give up. When I qualified as a pharmacist, we couldn't even sell a plastic syringe to a diabetic patient. It wasn't allowed. So how we practiced pharmacy then was very, very limited indeed. And all of these developments have come because of time, because of the needs of the population, because of the stresses on the healthcare service, and all these roles had to be done by somebody. And from time to time, we've had some really good leadership in pharmacy, in the profession, and they've shown the government the benefit of doing certain things in a certain way. So it's possible to make progress, and countries like ours can learn a lot from each other because we can point at successes in some other place in the world, wherever that is.
Yes, but it's important to make research like Piotr do. It's a very that's impact.
What I believe what is not published doesn't exist. So if I would like to reference now, for instance, I reference to the government now with my article about vaccinations, and we are the first one. I mean, my project was the first one in Poland to teach pharmacists really doing injections, and this is the only proof, basically real proof that can prove that we've done it as first ones, and there is a potential. Because what I hear in the media that everybody say pharmacists are ready. Okay, pharmacists are ready, but you say that they are ready. but what the research says, that's the truth. And I will always just maintain this thinking that what is not published doesn't exist in most of the time. So I think research is important, especially practice research. Excellent. I think we had a very good, exciting 1 hour. So thank you very much, Katrina, for your time, and also Mark. Thank you so much for making this evening today with us. I thought you couldn't make it, so I feel even double happy now to see you all being healthy and still fighting for the profession. I would like to also thank you to our audience today, our pharmacists who are watching this meeting, and I would like to invite you on Steve for the next one as well. And we are going to come back to the interactions, and we are going to have our friend Lieutenant Tomasz Herężak, also pharmacist, who is going to talk us about triple whammy and interactions between ACE inhibitors, basically diuretics and NSA. It's a very important thing because we show basically clinical significant interactions between the drugs, and we'll show you different scenarios as well that you can fully understand the process. Obviously, interactions is something that you like a lot, and we come back to it every time we can to provide you more case scenarios and interaction case studies. So thank you very much to everybody for this evening, and we shall see you soon on another webinar again. Thank you.
Thank you.
Thank you very much.
Bye.
Thank you, Katrina.
Bye.